Eyewitness News presents Newsmakers, winner of the Pennsylvania Association of Broadcasting Award for Excellence in Public Affairs Programming, with your hosts, Jayne and Bugda and Andy Mehalshick.
Hello and welcome to Newsmakers. I'm Jayne and Bugda.
And I'm Andy Mehalshick. Today we are focusing on the work of the AllOne Foundation and Charities across northeastern and north central Pennsylvania.
We'll also be talking about the Foundation's initiative to enhance autism services across the region. We'll introduce you to our guests, and our conversation will begin when this edition of Newsmakers begins right after this. Welcome back to Newsmakers. I'm Jayne and Bugda along with Andy Mehalshick. Our topic of conversation today is the AllOne Foundations and Charities. Perhaps you heard of them. Today you'll learn a lot more about them. And today we are joined by John Cosgrove, who is the Executive Director of the AllOne Foundation and Charities, and Dr. Debra Pelligrini, who is a Dean at University of Scranton. Thank you both for being with us today.
Thank you. Thanks for having us.
The AllOne Foundation and Charities had a big announcement, which we're going to be getting into and a little bit later in the show. But first we want to give our viewers a little bit of a better understanding about the AllOne Foundation and Charities. So how about a little bit of the history?
Sure, I'd be happy to share that happy news with you. First of all, I want to say thanks to you folks for your really great partnership and with AllOne Foundation and Charities and helping us from the very beginning to tell our story in northeastern and north central Pennsylvania. And it's a very good story. It's a very unique opportunity for the people of northeastern and north central Pennsylvania coming into the types of resources that AllOne Foundation and AllOne Charities has been able to make available to really, very simply, to improve access to health care, to make life better for our friends and neighbors here in northeastern and north central Pennsylvania. So we started when the major kind of tectonic shift in healthcare started to happen in northeastern and north central Pennsylvania. We all knew of it, we all experienced it. Our healthcare facilities, some going from nonprofit to for-profit status. You saw some pretty significant changes in health insurance providers and provisions in our community. And specifically when Highmark Insurance and Blue Cross Blue Shield of northeastern Pennsylvania started to talk together, that major transaction, which ended up being hundreds of millions of dollar transaction, when all was said and done, the leaders of northeastern Pennsylvania, north central Pennsylvania were successful in keeping a pretty significant percentage of those resources here in our community to do just that, to improve access to health care for those of us living here. But they didn't just stop at that. In other places, when you have that kind of tectonic shift in health care, it was almost typical to just set up a private foundation to get those dollars out. Well, here, the leaders in our community said, we're going to do something a little bit more innovative, a little bit more creative. So they indeed created a pretty significant private foundation, but they also created a public charity. And there is a difference between the two entities, but shared mission, shared vision. It's all about working collaboratively to improve life in northeastern and north central Pennsylvania.
And of course, laser focus is on autism services, families dealing with it, and all the collateral services with them. So expound on that a little bit.
So to talk about ACE?
Sure.
That would be excellent. So the Autism Collaborative Centers of Excellence. We came together, have to thank the AllOne Foundation right away for bringing all of us to the table. And it was a 19-month process. And as John always says, we stayed at the table, because when you think that you had people from ADMI, from MU, Misericordia, University of Scranton, Friendship House, Wyoming Valley Children's Association, came together and said, let's look at the 13 counties in northeastern and north central Pennsylvania. Let's talk about autism, ASD, autism spectrum disorder. So if we say ASD, please know what we're talking about. 1 in 68 are identified with autism. We have service gaps. There's waiting lines. What can we do to make a difference for this region? And John said, start talking about it. My board of directors will make it happen. And that's really started the story.
For sure.
I know you had a big announcement about this, and this was overjoyed for a lot of people in our region. How many families do you know that maybe have someone with a loved one in our area that are touched by autism?
It is measurable. We
Definitely.
figure conservatively that there's probably in our 13 county region about 17,500 people potentially that have a diagnosis of ASD or should have a diagnosis. So it's a significant
That's right.
percentage of our population. By family, it's not known. I can tell you that that when this ACE initiative even started, even the earliest conversations among the experts that Dr. Pelligrini mentioned, even in the earliest conversations, we were hearing back from parents, we were hearing back from families saying, this is necessary. We have in northeastern and north central Pennsylvania really a vast array of excellent services. The difficulty was that they weren't coordinated services, and they rarely talked to each other and shared information, and that's really the
correct.
heart and soul of the ACE initiative, is that these experts, these 11 agencies originally, have all committed to share information, to listen to each other and listen to the people that we strive to serve, and to minimize some of those service gaps that exist. And you know, frankly, when the family experiences a diagnosis of ASD or has been living with ASD, being a caregiver for folks well into their adult years, they're the real experts. They're the people that we really needed to commit to listen to. They told us, they are telling us what life is really like when a family experiences living with ASD. So they're the real experts, and they're the ones that we're committed to listening to, and they're the ones that we're committed to making it better for.
And John, I'm sorry.
Go ahead.
You were mentioning 17,000 people diagnosed
Correct.
or have a connection. When you think about, put that in perspective, that's, according to my numbers, is the population of Kingston, Plymouth, and Edwardsville.
That's correct.
Almost all of the southern west side of the Wyoming Valley.
That's right.
That's a lot of people. I mean, that's like filling the Luzerne County Arena 1.5 times.
That's right.
That's exactly
So
right.
we're talking about a significant challenge here.
We are.
I don't say
Right.
problem, a challenge.
A challenge. In fact, I would tell the viewers, go to paautism.org and you can break it down by county to show where we are with the census on autism. Lackawanna County, 2005, had 330 families, individuals identified with autism. In 2011, 905. That's a 174% increase. So check your counties out and you can see that there is a huge need for services from birth to later in life to help these individuals and to help their families and their caretakers. What do we do? And this is going to help solve that problem.
I know a lot of times when we have people, we have done a number of programs on autism, and a lot of people worry about the gap. After
Yes.
someone reaches a certain age, that there is really no programs or services for an older adult with autism. How will this help the families?
Well, by having these what we call family-friendly hubs, and there's 5 of them that are identified, that you can go to any of these hubs and we can help you go to the right network, to go for the right services. So if you would come into Wyoming Valley Children's Association, they'll be able to direct you. You need respite care, you're going to go to Misericordia, or we can help find that agencies to help get to your needs, because people don't know what to do. And so all of these 5 family hubs will have brochures, they'll have all of the information published, and we'll also do it virtually on our website. Hopefully our goal is to develop an app so that you can just click on our app and you'll be able to say, here's where you need to go.
Wouldn't that be wonderful?
So it's coming. It's not there
where
yet.
will the hubs be located?
Go ahead, John.
Yep. There's 5 of them initially located. One will be in Lycoming County in Williamsport at Hope Enterprises. There'll be 2 in Luzerne County. There's Misericordia University will be serving as a family-friendly community hub, and also Children's Service Center at their Hazleton location will be a community hub. The University of Scranton is dedicating a whole new structure entirely on autism services and the Autism Collaborative Centers of Excellence on Mulberry Street in Scranton. And who am I forgetting?
Your Misericordia is a hub,
mention that,
and Friendship House.
Friendship House, right?
And I think you got them all.
Yeah.
Now, is it a situation where, and we've done numerous stories and programs on Newsmakers here over the last 20 or so years, 25 years that Jayne and I have been involved in Newsmakers, where the time go, right?
Right.
But are families more willing to talk about it? In other words, do you think in yesteryear, not that long ago,
No,
were
I think
families
that's a great question.
cloistered and they dealt with it with their own doctors or with the experts, but are they more willing to come out and seek help and not, I don't want to use the word ashamed, but they didn't know where to go and they felt there was some kind of stigma with it?
Right. I think you're starting to see the change happen. We always knew that when you had children, kindergarten, early intervention, and that's what ADMI will be there for, genetic testing to help you get diagnosed early. That's one of our family-friendly hubs. But what happens after high school? When that IEP goes away or your special education teacher isn't there anymore. So now we'll have a way that they're saying, I need help. I want my son or daughter to go to college. Well, people, I see it now, 18-year-olds coming to the university with autism. There are on every campus resources available. Parents are talking about it more, and hopefully through the ACE collaborative, they'll be able to say, I want to share my story. I want to come together, and we'll be able to connect families together. In fact, one of our outcomes is to actually have, in October, to have the U.S. Disabilities Conference will be free to the public, and it will say, come see the outcomes of these family-friendly hubs, see the outcomes of the initiatives, and everyone will be presenting their research so that it's open to the entire community. All 13 counties, everyone's invited to come. So I think it's going to change the stigma.
I will tell you that, you know, as the head of a foundation, we hear an awful lot of, from all sectors of the community about some of the seemingly intractable problems that we face. The AllOne Foundation and Charities has been around since 2015. We've had grant cycles in 2016, 2017, and of course in 2018. But I will tell you this, Andy, you'll not find a more passionate advocacy group than you'll find in parents of children with autism. Our leaders told us from the very beginning of this initiative, listen to the experts. Listen to the experts. We're not the experts at the foundation. Our job is to convene the best and the brightest to look at these problems. And when it came to autism services, AllOne Foundation supported very early on the work at the what is now the Geisinger Commonwealth School of Medicine. Within the school, there is an initiative, behavioral health initiative, focused on autism services. It was those experts that did the initial study that identified these service gaps. And we, at the ACE initiative, we focused in on what can we do together to focus on making these, mitigating some of these problems and the gaps. Throughout this entire process, however, the real experts that we listened to were the parents themselves or the caregivers themselves. I know I would never break confidentiality, but there's a pair of moms that were our kind of kitchen cabinet on this. They were able to articulate to us what it felt like when they got that diagnosis, and what it meant is they really didn't know what direction to go in. They told us that they didn't know where to turn, that they were daunted by the waiting lists, that they were daunted by the collection of information that was coming at them. So we followed our leadership, and they said, listen to the experts, and we listened to the experts. And that's why this ACE initiative, I think, is so promising right now. And it really articulates the beauty of AllOne Foundation and AllOne Charities. And the fact is that we'll tackle these problems on our own if we have to, but we'd much rather do it collaboratively. We'd much rather do it by listening to the real experts, and then put the resources together to get the dollars where they'll do the most good.
Tell us a little bit about the goals that you have set up for the program.
Well, I hope you don't mind, but there are 9 goals. There really are 9 goals, so I'm going to.
We aimed high.
Hey, this is
I
your-
did,
this
and
is
I
your
don't
program.
want
Right
to leave
ahead.
one
No,
out,
it's
so
okay.
please forgive me.
You want to hear?
So here we go.
Okay.
The first goal is to create family-friendly ASD community hubs to assist individuals and families in identifying and navigating services throughout the region. And you've already heard the 5 family-friendly hubs. Then establish a coordinated network of qualified ASD providers to facilitate regional access to evidence-based care so that we can keep people in our regions, in our 13 counties. 3, deliver a full array of services that supports for individuals with ASD, from early interventions to adult services. 4, provide a coordinated, comprehensive approach to the identification and treatment of ASD for children, adults, and families. 5, and I think this is huge, promote evidence-based practice as the standard for ASD treatment in the region, and I'll come back to that one later. 6, enhance undergraduate and graduate training opportunities in ASD-related fields so that we can create a highly talented, skilled pool of experts for our region. 7, expand opportunities for respite care for families. 8, ensure a consistent, seamless approach that allows for tracking service delivery transitions across multiple agencies. And then 9, implement an ongoing process for data collection, analysis, and the reporting of outcomes and recommendations from the coordinated network of qualified ASD providers to enhance the delivery of evidence-based care across northeastern and north central Pennsylvania for individuals with ASD and their families. Now, that's a lot, and that's a mouthful. But the key to remember is this is going to produce outcomes that we're going to share. It will be open, and that we will have a coordinated, seamless network that provides the gold standard for care for ASD.
Well, we want to remind everyone that you can find the information that we're talking about today on pahomepage.com. We have a link to your website.
Excellent.
For the autism, and we also have a link to the AllOne Foundation and Charities website so you can learn more. Now we're going to take a quick break, and when we come back we're going to learn a little bit more about AllOne Foundation and Charities, more that you do, and talk a little bit about your grants. Information on today's show can be found on pahomepage.com. We're under the Newsmakers link. You're watching Newsmakers, and we are a proud recipient of 3 Pennsylvania Association of Broadcasting Awards for Excellence in Public Affairs Programming, and we'll be back right after this. Welcome back to Newsmakers. Jayne and Bugda along with Andy Mehalshick, and our topic today is the AllOne Foundation and Charities. In our first half, we talked a lot about the new big announcement about the autism services, and you can really feel the passion for that. But we wanted people to also know about some of the other organizations that you're involved with, and how you've helped reach out to them. So you touch a lot of lives. Tell us a little bit more about some of the other programs.
That's a really great way to put it, Jayne. We touch a lot of lives. AllOne Foundation, as I mentioned before, is a private foundation. AllOne Charities is a public charity. So the real distinction that our leaders make there is on the AllOne Foundation side, they really do things a little bit differently. Rather than a typical private foundation where we'll get requests for proposals and we'll ask folks to tell us what they need. What our leaders did and do is identify those seemingly intractable problems, and then we seek and we vet and we make grants around those problems and how we can have the highest possible impact. I'll tell you what we've done. We've done major grant programs, not only in autism, but we've done major grant programs in behavioral health and mental health programs, in improving access to health care for women. We are now presently tackling the scourge of the opioid problem in our neighborhood. So on the AllOne Foundation side, it's high impact that we're looking for. On the public charity side, on AllOne Charities side, I don't want to say low impact because that wouldn't be accurate. It's we seek to work with the frontline providers to expand or sustain their really good programs. So some examples: we work with Meals on Wheels in northeastern Pennsylvania, for instance. They have a really terrific idea. On top of delivering the meals, they also asked us for some resources to give caregivers meals as well, which is a really specific need, and that's what AllOne Charities does. We work with community organizations, because AllOne Charities isn't just a grant-making entity, we're also a grant-seeking entity. So we work with a lot of community organizations to help sustain their fundraising experts or events. For instance, Bernie's Run in downtown Wilkes-Barre every 4th of July for the last 35 years. AllOne Charities came in a couple years back to work with the Wilkes-Barre YMCA to expand the Bernie's Run. We brought in 4 other regional YMCAs to work with them. So we work with Bernie's Run. We work with, in fact, we've had 6 events in the last couple of months. 5K races, family bike rides, whatever it takes to help frontline organizations expand their impact in their communities.
If there's a nonprofit group out there who's watching this program now, and maybe they're just hearing about your foundation and your charities, can they get involved, and to what degree? How would they get involved, number one? And number two, would you guide them in your mission?
Sure, absolutely. And what we know about northeastern and north central Pennsylvania is that there are really good, smart, passionate people working in our neighborhoods and in our communities, and many of them are working in nonprofit organizations. In fact, part of the initiative with ACE we've found is you don't have to be a huge multi-billion-dollar organization to have direct and measurable impact. Very often we've found that it's the nonprofit organization striving to serve their neighborhood or their community that some of the best ideas are percolating out of. So we want to hear from nonprofit organizations, particularly on the AllOne Charities side, to see how we can all work together to make their work more impactful. So they can contact me at AllOne Foundation and Charities, or our program officer, Mary Carol Donahoe. You can reach us at 570-208-1200. We'd be happy to talk about how we can get resources in their hands to do the most good. But really, we're interested in having those conversations about how they're impacting their community and their neighborhood, because, as I said, sometimes that's where the best ideas come from. And that's what AllOne Charities is all about. We want to expand that work, we want to sustain that work, we want to make that work even more impactful.
Because as with neighborhoods, or as with families, they know their loved one.
Correct.
And the nonprofit, they could be small compared to others, but they know the neighborhoods.
Absolutely.
And they feel it. There's a rhythm there.
That's right.
That's right.
But I can tell you, someone that's worked with AllOne, they really walk the talk. So if I need anything, so no matter how big you are or how small your organization is, do not hesitate to pick up the phone. John always returns calls. Mary Carroll is excellent. Gee, they're such a great organization. I have to tell you, I work with a lot of organizations, and they are always pleasant, and no question is too small.
Well, that's very nice to hear, and we appreciate it. And but I have to say the credit goes to the people of northeastern and north central Pennsylvania. You know, just from a personal standpoint, we rarely give ourselves enough credit. We were talking a little bit earlier
I agree with
about
you, John.
Yeah,
Generally speaking, in the area.
Yeah. Sometimes the greatest ideas, sometimes the most impactful things are happening right in our own neighborhoods, and our folks, our friends and neighbors are laser focused on getting the job done. Very, very often, or too few times, do we pick our heads up and look around and say, you know what, there's some really wonderful things happening here, and it's a great place to live and work and raise a family. That's what AllOne Foundation and AllOne Charities wants to be. We want to be the catalyst for impactful change in northeastern and north central Pennsylvania.
And I do want to remind everyone that you can find information on AllOne Foundation and Charities on our website, pahomepage.com, or under the Newsmakers link. John, Dr. Debra Pelligrini, thank you so much for joining us today. It goes very fast.
Good. Great job. Thank
For
you.
Andy Mahalshick
Thank you.
and everyone behind the scenes, I'm Jayne Bugda. Thank you so much for making Newsmakers part of your day, and we'll talk again next time.